Good afternoon, Mike. We are live for our normal Tuesday spot.
Hey, how's it going? Can you hear me?
Great, great. So, Mike, yes, can you hear me?
Yeah,
Can you hear me? All right, good.
yeah.
So, a couple years ago, Mike, when we talked about COVID, COVID 19, things to do to prevent COVID 19, things to help the infection, we were blackballed, posts were taken down, and this happened on a regular basis. And now, uh, those kind of posts seem permissible. So I figured we would talk a little bit about one of those topics today.
Absolutely. Let's talk about our good friend Chris Kresser and what he had to say about it and our follow up to what he had to say about it.
Yeah, well, we can't go a couple weeks or months without doing some sort of StreamYard or video or something on vitamin D. But uh, in the Journal of Nature, which is one of the most well-respected journals in the world, it had a study on COVID-19 and vitamin D3 levels. And basically, as the title of this talk says, is treatment with vitamin D associated with lower risk of death and infection from COVID-19.
Remarkable. We have been saying this for a couple of years. There's no denying that, and it's not just us. It is literally thousands of people in health and wellness space that have been saying this. Um, Chris actually did give a presentation on this um, on at a nutrition and functional medicine symposium. So, what did it say exactly?
Uh, Basically, vitamin D3 reduced COVID-19 infections by 20%, and COVID-19 mortality by 33%. And it even goes further in saying higher doses of vitamin D led to greater benefits than lower doses. Basically, saying you need to take a whole bunch of vitamin D, and you're going to have 1/5 of a chance of less getting COVID and 1/3 less of a chance of actually dying. I mean, that is huge. There's no reason why that's not frontline prevention and frontline treatment for COVID-19 and for any other infection for that matter.
So, just so we're crystal clear, vitamin D reduce infection by 20% and reduce death by 33%, one third. That's remarkable. This should have been a front line defense for COVID and prevention. And once you had COVID, a valid treatment for COVID as well. Remarkable.
Yep. And let's just tidy it this short StreamYard with saying, if you know your vitamin D3 levels, we can help you maximize those. If you don't know what your D3 levels are, we highly recommend you getting uh, a blood test to see where your levels are, and then we can easily help you maximize those. It's hard to give a standard dose, Mike. Probably somewhere between 2 to 4,000 a day for an adult. Maybe 1,000 for a kid under 13. Those are like generic recommendations. I believe the RDA is 400 IU's, which is woefully too low. But please, if you have questions on what kind of vitamin D3, how much you should take, when you should take it, please get your blood work, share it with us, and let us help you maximize those numbers.
And we often see in people that come in to our office, folks that are on a prescription of vitamin D of 50,000, but it's not D3, it's D2. And D2 is the inactive form of vitamin D3. It needs to be activated by vitamin K2.
Yep. And
So you want to double check that, check with your physician that's given it to you. You need the activated form.
And quite frankly, depending on your numbers, 50,000 IU's once a week may still not be enough to budge those numbers. It really depends on how low you are and where you are in that spectrum.
Yes, as we've had patients come in that have been getting their vitamin D levels taken in addition to be on the prescription vitamin D, and we've seen where it hasn't pushed them into at least the 30 nanograms per milliliter.
Yeah. So the average range is 30 to 100, 30 being the low end of normal, 100 being the high end. And I don't know about you, Mike, but I don't want to be on the low end of normal. And that's where, most people are below or right at the low end of normal. Most of our mentors say you want to be around 60, 70, maybe 55. But I say, no lower than 50.
Agreed, and no lower than 50. You basically are looking for an optimal level, and as opposed to low normal. So I would say you would want to be in that level.
So just like vitamin D3, I look forward to having more natural health information when it comes to COVID-19 and viral infections. And as they come through, Dr. Mike and I will bring them to you. We are open today from 3 to 6, fully staffed.
Have a great day. See you.